everyone. Welcome back to Arthritis Broadcast Network. Here at the CRA, #CR Arthritis. We are so happy to have Trudy Taylor here with us today. Thank you for joining us. Would you mind sort of telling us a bit about yourself and how you're involved in rheumatology?
Sure. So first of all, thanks for inviting me. I'm delighted to be here. So I am a rheumatologist in Halifax, and I've been practicing for almost 12 years. Time flies. And I got interested in rheumatology when I was a medical student, and I did a rotation in rheumatology and found a wonderful mentor and found some fascinating science behind what we do in rheumatology. And then there was this big boom of therapies that were becoming available around that time. So it just really sparked my interest. And that's kind of really what got me involved. Yeah.
Great. And I know you're also really involved with education, medical education at Dalhousie's.
Yeah. So my same mentor, actually, I've always had a passion for education, and my mentor also did a lot of medical education, and so it just helped me make great connections. I think that happens when there's small communities of people across the country. Yeah.
Absolutely.
Yeah. And
working as an educator now, what are some things that you hope to instill in the next generation of physicians?
Yeah, I think aside from sort of the science and the nitty-gritty of what we learn in medicine, I think there are so many other facets to what we can teach and to keep in mind. And I think one of the things that I have a real passion about is about trying to instill tools for lifelong learning. And so one of the things that I've done some work with is around guided self-assessment or informed self-assessment. And I think that's really something that's important in teaching students and residents to really become great lifelong learners, be able to assess themselves, know where they need to continue to improve, and really set them up to be great clinicians.
And it's so important in this field, as we've seen in this conference, with things are changing so much with the technology available, and so it is important to be a lifelong learner.
Absolutely,
for sure.
Yeah.
So last night you were part of the infamous Great Debate,
Yes.
And your team was very successful. So would you mind speaking a bit about that?
Sure. So the debate, the debate is really fun. So the debate at the CRA conference is always one of the highlights of the conference. And this year it was a resolution stating that precision medicine, with some examples around artificial intelligence and advanced immunology, would decrease the need for rheumatologists in the future. And I was lucky enough to be on the negative side of that.
Did you get to choose?
I didn't. Okay. I was just lucky. But
you did agree with what you were.
Yes. Oh, yeah. I knew I had the side that I was passionate about. So I think that showed, and I think that it made for an easier time with the debate.
Yeah, so can you tell us about some of your key arguments that your team used?
Sure. So I think probably key to all of this is, we when we were reading the resolution, we said, well, we like precision medicine. We think it's really important. That's part of all of the advances that are happening. It's a huge part of this conference here. And so, and there's been a lot of advances that have been made with precision medicine, whether it's related to therapies or related to investigations that we do with blood work and imaging, that really have improved our ability to treat diseases and improved our patients' lives and function and all of the good things. But the real kicker of this was that it's going to decrease the need for rheumatologists. And so the big arguments were, rheumatology is so much more than just diagnosing and managing, and a real central part of that is our relationship that we have with our patients. And the importance that you can't replace that with a computer algorithm or with a blood test. You can't replace developing those long-term relationships and spending time and developing trust, and shared decision making. Right. So I think we were speaking to a crowd that knew that, because that's what we practice on a daily basis. And so it actually made it easy, because we didn't have to argue against all of those positive things that our opponents brought up. And of course it's true. There are a lot of great things about precision medicine, but it's never going to take away that human role of the rheumatologist. So,
somebody I was speaking to yesterday, Warren Niman, made a really interesting point that, this conference, it's centered around precision medicine, specialized medicine, and personalized care is a separate thing, and just as important, which is what you're talking about, which is the social side of it, and the relationship building and trust between the patient, physician, their entire healthcare team.
Absolutely. So I think I wish I used that term, personalized care, but I think it's so important, and it's equally, if not more important. So.
Yeah, that's great. Well, I know we've sort of touched on it through that, but what else do you think about, digital health and social media in relation to patient care?
Yeah, I think that it's probably underutilized. I think that there are a lot of things that we could leverage as far as, education and making connections for everyone involved in sort of that healthcare bubble. And I don't just mean healthcare practitioners, I mean patients as well, and making those connections. I think there's probably a lot of fear, and there's a lot of fear for privacy reasons and who knows what else. But I think that if people try it and develop some comfort with it, there's I think there's a lot of potential power behind use of social media.
So as a patient myself, something I'm always curious about is there a risk with all of this information now accessible to us through social media, through our phones? Could we be sort of actually learning the wrong information?
Yeah, absolutely is the short answer. But I think that's something that, again, that can be something that makes for really good conversation with your physician, for instance. Just being able to sort out and kind of critically appraise what you're reading, and knowing what are the good sources. And so I think on a physician side of things, I think it means it's really important that we're open and approachable, so that if you read something and you have a question about it, you can bring it to us, and we can have that discussion, and not just a discussion to say, no, that's not true, but more, well, actually here's some other information, here are reasons why that might not be the best source, right? Or, the other way around. Sometimes patients bring things to me that, that I hadn't seen before, or that are emerging, or who knows, right? So I think there can be a lot of really good dialogue there, and great learning.
Absolutely, and that really, symbolizes that patient is an equal partner.
Absolutely,
so really wonderful. So I know that you had a workshop earlier today.
Yes, I did.
Could you tell us a bit about that?
Sure. So I am very lucky to practice closely with some of our pediatric rheumatologists in Halifax, and I do the transition clinic there. So I spend a fair bit of time with them. And so we were asked to do a workshop on something called macrophage activation syndrome, which is a rare syndrome, and it was that causes a lot of inflammation and kind of multi-system disease, and it happens. It can happen secondary to some of the rheumatic diseases that we deal with. And it was first described in the pediatric population. So I got to do this joint workshop with my friend and colleague, Dr. Lang, on recognizing that in adults. So we do see that happen sometimes with adult patients as well. It's very rare, but very serious and important to kind of pick up. So we did a workshop about it. We used cases that we had in our own population in Halifax, and so it's not always nice to use real cases instead of just using cases that are made up for illustration and are kind of picture perfect. And so we basically just worked through cases with the audience and had a lot of good interaction.
And all the real complexities involved in the real
Absolutely.
life cases.
I know, and I felt like I kept saying, I didn't make this up. Like, this is real. This is what you're going to see. Yeah.
Okay. And this condition that you're speaking about, does it come about because of like medication use, or is it the actual effects of the rheumatic diseases?
So there's a lot that's not known about it. So, but it mostly is related to the effects of the rheumatic disease. Okay.
Okay.
It can be associated with things that aren't rheumatic diseases as well. But there are some studies showing that sometimes stopping medications can increase the risk of developing it.
Interesting.
So, but like I said, it's so rare. It's really difficult to get a lot of great data on it, and I think that's why it lends itself to something like a workshop where you can kind of work through cases and have good discussion. But I can't tell someone like do this test and it'll tell you absolutely that it's macrophage activation syndrome, because there's a lot of nuance to it. Yeah.
Interesting.
Yeah.
Very interesting. So was there anything else at this workshop that you found specifically interesting? Sorry, at this conference in general?
Oh my goodness, yeah. So there's been a lot of great things. One of the things I think that there's a lot of emerging information about is around myositis, and so there's been some really nice workshops around that.
Sorry, would you mind explaining what that is?
Sure, yeah, no. So myositis is it's kind of a catch-all term, but it's autoimmune diseases where you have inflammation in the muscle. And there's a lot of really been an explosion of knowledge about myositis in the last few years, because we used to kind of just have one or two terms that we would use for it, but it turns out that it can look a lot of different ways, and there are different antibodies that can cause it to behave differently.
Okay.
And so there's been a lot of translation of knowledge about those things here at the conference, which has been really great. And I think there's been a lot of new knowledge that we've developed in Canada, which is really exciting. Yeah.
It's always exciting when it's our country.
Yes, right? Exactly.
Like the Olympics. Right?
I know, right?
Pretty exciting.
Love those two.
Anita, is there any questions from our audience?
In terms of artificial intelligence and digital health, there are risks of privacy and machine error. What would you say to patients who are concerned about this?
Yeah, I absolutely agree. I mean, I think that's one of the arguments against. I think that it's one of the arguments. So as far as the question of machine error, I think that's a big part of our argument, in that, sometimes these things can help supplement us, but they'll never take the place of human intelligence and having someone kind of looking at the bigger picture. And certainly the question of privacy always comes up, I think, whenever we think about digital health and where things are housed, where the information is housed. And so I think it's definitely a concern, and it's a concern that would need to be addressed before kind of moving forward. I mean, that's even a concern with things that we do now, like with electronic medical records, for instance. I am definitely not an expert with that, because I don't have an electronic medical record. I work through a hospital, so it's a different system. But I think, we definitely rely on other professionals to help us make sure that we're kind of complying with those privacy issues.
And is that okay for patients to ask their physician where all my data is being stored?
Absolutely. I mean, that's your data and your personal information. You certainly have every right to ask that, and I would encourage you to ask that. Yeah.
Mm-hmm. That's really good information to know as a patient.
Yeah.
Thank you so much.
Yeah, no problem.
Well, it was a pleasure speaking to you today. Thank you so much for joining us.
Thanks. Thank you for the invitation. It was great.